Hello, this is Dr. Charmaine Herman, and I'm back again for another episode of Cultural Competence. Thank you, ChiroSecure, for having the opportunity to talk to other chiropractors about these issues. Thank you for this programming and allowing us to go ahead and share all this information. I want to go ahead and get started because I have a few things to talk about today. Now, today we're going to discuss we've been talking about cultural competence and how it affects us as doctors of chiropractic. Right now, in this segment, I'm looking more at things such as health disparities. So again, I'm Dr. Charmaine Herman. I'm a practicing chiropractor at Alpharetta, Georgia. I'm also a associate professor at at Life University in the College of Chiropractic. I've been there now it's been 13 years, and I teach and educate the future doctors of chiropractic about how to be better doctors, how to understand their communities. That's a big part of my educational goal, helping these new doctors. I'm originally from New York, and I graduated from the University of South Carolina, and I've been a chiropractor now for almost 15 years. So our goals today, we have two topics. We're actually going to talk about the African American community, and we're also going to talk about the health disparities that affect Black and African American communities. When I say Black/African American, people tend to want to be called based upon their nation of origin. So many people of color like to be called Black because they might not be from the United States, but they are associated with Africa, and they just rather just be called Black. Where other people who are associated with this country, born in this country, families that have been slaves in this country, want to be called African American to show both their kinship with Africa as well as their kinship with this country. So you can use either terms. They're used interchangeably when we look at data from the CDC or from the Office of Minority Health. And when you come to meeting patients that are of color, you may want to ask them if they would prefer to be called Black or would they prefer to be called African American. If your intake forms have that information, let them check it and let them decide how they would like to be addressed. So definitely always ask people how they would like to be addressed, what they like to be called, what they're comfortable with. That's just one of the things we've been talking about as being culturally competent doctors of chiropractic. So we're going to move on with the slides. Now, health disparities are defined as defined as differences in health between various population groups. And that's the key. We're looking at populations, not just your community, but an overall U.S. population. So when we talk about health disparities in this moment, we're talking about the entire United States and different populations within the United States and how these differences may affect the health of individuals. So when we talk about health disparities, we're normally talking about people who are adversely affected by various things and how they obtain health care in the United States, whether it's because of their age, their race, their religion, their gender, their sexual orientation, their ability or inability, any mental health issues, or geographical location. We're talking about how people actually obtain health and how this systematically affects various groups in our country, usually the ones that have been excluded or find themselves being discriminated against in our society. So we're looking mostly at our minority groups in the United States, and we're talking about health disparities. And these are the groups of folks these are the groups that we want to care for as doctors of chiropractic. We want to actually make an impact in their lives because we want to take chiropractic to the world. We don't want to just keep chiropractic an exclusive club, but we want to take it to the world. So it's good to understand how health disparities may affect those people that we, as doctors of chiropractic, care for and want to care for. So things that can also lead to various health disparities are things such as poverty, again, access to health care, behavioral or mental issues, educational inequities. I heard someone tell me recently, well, chiropractic is an exclusive group of people. People who go to chiropractors usually have a certain financial level, they live in certain communities. It's not something for the entire US. It's not for all the communities in the US, but it is for everyone. So we need to be aware of the factors that would keep people from seeking chiropractic care or understanding what chiropractic care is, because of a possibility of education inequities. They don't know what that means. What does chiropractic, what's different from medical doctors? How do I know the difference? So understanding that chiropractic is for everyone. It is up to us to deal with health disparities so we can meet the needs of our entire population. There are also some non-biological health disparities, not because of race or gender, but there's some things that would cause individuals to find themselves more subject to experiencing health disparities. Things such as violence with women. Women are more likely to experience violence, mental health disorders in men, alcoholism and abuse. These are what we call socioeconomic conditions that can shape individual's gender, which can also shape their access to health care and chiropractic care, and put them in that level of finding themselves in disparities when it comes down to health care. So we put them in those groups because, again, women are most likely in this country, it's like 90% of violence is against women. So they find themselves also, based upon their socioeconomic status, unable to cry out and get the help that they need. So this puts them also in a category of health disparities. So we as doctors of chiropractic wanting to serve more and more diverse communities ought to look into certain things. We need to first be aware of the health disparities that affect our communities. Every community is different. We all practice in various areas. Some of us are in hospitals, some of us are in clinics and things such as that, or we teach at a school like I do, but I still have a private practice. But I need to be familiar with the health disparities that affect the minorities in my community so I know how to better help them reach better levels of health in my office. I should also be very careful about monitoring my patients who I know have pre-existing conditions such as hypertension or heart disease. I want to pay attention to them when they're in my office because they're more likely to be in my office than they are in a medical doctor's office. So I want to pay close attention. I want to monitor and document things such as blood pressure. I do that for all my patients that have hypertension. I check their blood pressure pre and post adjustments to make sure that the blood pressure, if it's changed, that's great. If it's lower, that's amazing. But I want to make sure that their blood pressure is at a level that is comfortable because it is a silent killer. So I monitor those things for my patients who do have hypertension in my office. I also, as a doctor of chiropractic, we also be able and willing to make referrals. If a patient is in our practice and we don't see them progressing under chiropractic care, and we also see some other issues presenting themselves, then we ought to be willing and able to refer to the right healthcare provider so our patient can get the best care. So again, a patient in my office who may have hypertension and it's not being controlled and it's getting worse and worse and worse, I'll definitely want to refer them to a cardiologist or a clinic in my community where they can get the care that they need based upon that condition. Chiropractic is amazing. We know when we clear the nervous system, the body responds well, but there is still a limitation of matter. And some people's bodies don't respond as well, and they do have these pre-existing conditions. So we should be willing and able to refer so our patients have better outcomes when they're under our care. So I'm going to give an overview. A lot of this information is a lot of statistical stuff, and no one likes statistics, but it tells us a lot about our communities. So I'm going to talk a lot about the statistics with our Black and African American communities. So again, this is a lot of numbers, a lot of dates and things like that. So I apologize ahead of time, but I think it's important to understand where our Black and African American populations are in our country. In 2019, 40.6 million people in the United States are considered non-Hispanic Black. That's about 12.8% of our population. Blacks, African Americans are the second largest minority group in the United States, which Hispanic and Latinos being the first. In 2019, the majority of Blacks lived actually in the South. If you whether 58.7% of African Americans or Blacks lived in the South in this population, compared to 35.8% of non-Hispanic whites. The largest cities that have Black and African Americans are places like Texas, Georgia, Florida, New York, North Carolina, California, Maryland, Illinois, and Virginia, as well as Louisiana. That was in 2019. So the populations of African Americans are not a large population. It's actually considered what's called an emerging majority as more and more our populations are changing by 2050. But again, it's 12.8% of our population. We'll find most of them in the South, but we still find them mostly also in urban areas. Not so much in the South. We see them in a lot of rural areas, but they're also in a lot of the urban areas in the South as well. We talk about economics. Um, According to the Census Bureau in 2019, the average non-Hispanic Black median household income was $43,771 compared to $71,664. We're looking at our non-Hispanic white populations. In 2019, it was reported that 21.2% of non-Hispanic Blacks compared to 9% of non-Hispanic whites were living at the poverty level. So that's something to pay attention to. When we're talking about people living at the poverty level, these are folks that really need our care. In 2019, it was also seen that unemployment rates for non-Hispanic Blacks were twice as much as that for non-Hispanic whites. That was at 7.1% compared to 3.7%. So many people that need our care are those that are unemployed and are living below the poverty level in our country, unfortunately. In 2019, we're looking at health insurance, and that's a big issue because many docs say, well, people can get health insurance to afford our care, and that's true, but not everyone is taking advantage of health insurance. And a lot of people qualify still for health insurance. In 2019, 55.9% of non-Hispanic Blacks compared to 74% of non-Hispanic whites use private health insurance. 43.5% of non-Hispanic Blacks compared to 34.3% of non-Hispanic whites actually relied on Medicare. As well as public health insurance. And 10% of non-Hispanic Blacks compared to 6.3% of non-Hispanic whites are just not insured at all. I had the experience of having someone come to my office who was insured. He was an African American gentleman, and he was insured, but chiropractic was not covered under his insurance. And then he had the issue of also being unemployed. So he had not employed, but he was also on disability with his job because he could not work due to the issue he was dealing with, the condition. So I ended up seeing him. I think we saw him for almost a year, without charging him for the care because I couldn't see myself charging him, and he wasn't employed, and he was able to get back to work. And what was so great that just really blessed us is that after he started back to work, he would send us money to thank us. He sent us over $500 at one point just to thank us for taking care of him when he wasn't able to do better. So, I mean, the reward was there. I mean, a lot of people don't want to see patients for free, and I understand that we have to keep our practices going. We have to actually live and survive, but part of our chiropractic oath is that we deliver care despite of a person's ability to pay. So we delivered care, and we saw some great results and got some really great feedback from him. So that was a great thing to do for us, and we felt really good about it. When we talk about life expectancy, African Americans, or we say Black African Americans, as far as in the year of 2020, the birth rates were at from life expectancy from birth to death was 77 years as their average. Women lived 79.8 years compared to men, 74. Compared to non-Hispanic whites, where the projection is 80.6 years of age to live between life and death. And the men lived to 78.4, where women lived to 82.7. In both cases, again, the women do live longer, and we do see that in most communities, but African Americans are projected to die at a younger age compared to white Americans. Generally, we see higher mortality rates for African Americans due to heart disease, stroke, cancer, asthma, influenza, pneumonia, diabetes, HIV/AIDS, and homicide. Looking at infant mortality rates, it's also documented that non-Hispanic Blacks have a 2.3%, 2 times higher percentage of mortality rates when we're talking about infant mortality. We also see that babies will either die from complications or from a low birth weight, as well as they're 2 times most likely to die from SIDS, sudden infant death syndrome. In addition to that, in 2018, it was documented that non-Hispanic Black African American mothers were twice as likely to receive late prenatal care as compared to non-Hispanic white mothers. It's also documented some research now about treatment even in hospitals, how women of color, Black African American women, or even Hispanic women tend to be ignored in hospitals after having babies when there is an emergency and are most likely to die. after childbirth in our country today, and that to me that's an atrocity. With all the healthcare that we have out there, all the wonderful technology we have for mothers to actually have to die because they're being ignored in the hospitals when they tell the nurses or the doctors that they're not feeling well after having given birth and things like that, and they find out later that they have a complication and they die after giving birth. So that's another issue I believe that our country needs to work on as far as better treatment for all people in our facilities. When we go on to things such as African American heart disease, in 2018, African Americans were 30% more likely to die from heart disease compared to non-Hispanic whites. Although African American adults are 40% more likely to have hypertension or high blood pressure, they are less likely than non-Hispanic whites to have their blood pressure under control. That's whether due to medication or due to things like chiropractic care that has been documented to be able to help with controlling hypertension, things like that. They're still most likely not to have their hypertension under control. And African American women are 60% more likely to have high blood pressure compared to African American or compared to non-white, non-Hispanic white women. This is a chart done by the CDC showing the differences in non-white Hispanics, blacks, non-whites, blacks, and Hispanics, looking at hypertension. And in all three of them, the total black women, men are still the highest levels of hypertension in our communities. That's why, again, that's one area I definitely monitor on my patients, especially if they are African American or black. I do check their blood pressure pretty regularly because of those statistics. Looking at things such as cancer, African Americans are actually more likely to die from all cancers compared to any other population group in our country. In 2014 and 2018, African American men were most likely to die from prostate cancer or colon cancer. Same thing with stomach cancers. As well as Black and African American men have a lower 5-year cancer survival rate from most cancer sites compared to other populations, especially non-whites, non-Hispanic white men. Black African American men are twice as likely to die from prostate cancer. In 2014, 2018, the data shows that Black or African American women were just as likely to have been diagnosed with breast cancer. However, they are 40% more likely to die from breast cancer than non-Hispanic white women. Black and African American women are also twice as likely to be diagnosed with stomach cancer, and they are 2 times more likely to die from stomach cancer compared to their white counterparts. Asthma is a big thing. I meet so many patients with asthma, but I've noticed that most of them are people of Black or African American heritage. And the data shows that 2.7 million non-Hispanic Blacks are reported to currently have hypertension in 2018. Non-Hispanic African Americans were 40% more likely to have asthma than non-Hispanic whites. And in 2019, non-Hispanic Blacks were 3 times most likely to die from asthma than non-Hispanic whites in the population. Also, the death rate of children with asthma who are Black or African American is 8 times higher than those of non-Hispanic white children. And lastly, non-Hispanic Black children were 5 times more likely to be admitted to the hospital for asthma compared to non-Hispanic white children in 2017. So again, chiropractic is wonderful. We have seen miracles with young people with asthma, and there's so many young people that have not had the advantage of being under chiropractic care and can see their bodies just heal from that. I know quite a few that have seen some really great healings. I call them healings because they haven't had an asthma attack in months or years after coming under chiropractic care, and I'd love to see that for all our other populations as well. Obesity is always an issue in our country. We still have an obese population in many areas. Blacks and African Americans tend to be 4 out of 5 times about 4 out of 5 African American women tend to be overweight or obese. In 2018, non-Hispanic Blacks were considered 1.3 times more likely to be obese compared to non-Hispanic whites. African American women are 50% more likely to be obese than non-Hispanic whites. And let's see, 2018 African Americans were 20% less likely to engage in physical activity as compared to non-Hispanic whites. One thing about data, I think data can be skewed if you're not careful and understand data. Our numbers of what we currently, the rates or the numbers that we use for obesity, as far as what weight means that makes a person obese, I think that also needs to be changed. Most Black African American women have larger bone structures, and I think we see that a lot with our patients, and the documentation is there. So the term obese may not be the best term for women who are larger and may have more weight, but they also have heavier bone density. So that's a big part of that as well. So I think those also need to be altered just a little bit to not to make African Americans look that they're just eating everything and they're just fat and large. And I think that's an understatement for how the numbers actually look. So I looked at this data and I thought about it, especially the one about people getting physical activity. When we look at 10% of our population of African Americans and Black being living under the poverty level, I don't think getting exercise or finding a park to walk around is top of their list when it comes down to actually making sure you're able to feed your family. So I do believe the data can be a bit skewed based upon people's ability to even go to a safe area to walk or get exercise and things such as that. So again, I'm giving a lot of data, but I take in consideration actual people and the conditions that they may find themselves in. Mental health is also an issue. Right now, suicide is a big thing among young people, and in the 2019 data shows that it was a second leading cause. Suicide is a second leading cause of death for Blacks or African Americans between the ages of 15 and 24. The data was very shaking to me when I read it. Death rate from suicide for Black or African American men was 4 times greater in 2018 than African American women. Overall suicide rate for Black or African Americans was 60% lower than that of white Americans. Black females grades 9 through 12 were 60% more likely to attempt suicide in 2019 as compared to non-Hispanic white females in the same age group. Poverty is a big area that affects mental health, and those who live under the poverty level are twice as likely to suffer from psychological disorders because of the stress from being under the poverty level. And even the Surgeon General found in 2000, between 1980 to 1995, the suicide rate among African Americans between the ages of 10 to 14 increased 233% compared to 120% when looking at non-Hispanic whites. So we do have children and young people that are really in danger of suicide and not being heard and going through all these so many horrible things in our country. And these are things we need to pay attention to when our patients are in front of us, when we're seeing them and talking to them. These statistics may not be just for your area, may not just be for the United States, but what's important is going to places like the Office of Minority Health. And if you go to their website, Minority Health / hss.gov, they can actually you can actually find what the numbers are for the people of African American or Black descent in your community. So you see specifically what those numbers look like. I just gave an overall for the United States, but going to their website is where I actually went to get the information. And they have every minority group and every community. So you can actually look at your community and see what those numbers are, as well as contacting the county health department for your state or your community to find out what those numbers are, what issues are prevalent, what health disparities do exist in your community. Another place to go is the CDC. because the CDC also has an Office of Minority Health and Health Equity, and they also have training in cultural competence. So in the CDC, you can also find data for what's going on in your community so you can be more informed and know where the needs are for the people that you hopefully want to serve as a doctor of chiropractic, and not to let any stone go unturned or anyone fall through the cracks that could actually benefit from chiropractic care, because what we do is so amazing for everyone, and everyone should be included. So next episode, I'm going to talk about the Hispanic and Latino Latin community in our country. I'm also going to talk about health disparities that exist within the Hispanic Latin communities as well. So I hope you come by and check those out. Thank you again, ChiroSecure, for giving me a space to talk about things like health disparities. They're not always beautiful. They're not pretty. The picture actually is very, very sad in many instances for me as a woman of African American Black descent. So I definitely want to pay attention to what's going on, because I want to be able to serve my community, because it's like serving my family. So thank you for tuning in. I hope this gave you some great insight and information. I look forward to seeing you again. Thanks again.